If you struggle with knee pain despite doing all of the right hip and knee exercises, you may be missing a key piece of the puzzle, your foot and ankle. In this video, I'll explain how they affect your knees and show you some simple exercises to help you feel better without surgery. When your foot hits the ground, doing activities like walking, squatting, or climbing stairs, your hip, knee, and foot all function together. If there are problems down at your foot and ankle, it can have upstream effects. Now, your foot and ankle biomechanics are incredibly complex. Most doctors and physical therapists don't even understand it fully. However, I'll break it down in simple terms so you can understand why the exercises that I'm about to show you work so well. Now, there are lots of tiny little joints in the foot and ankle, but the three main ones we'll cover in this video are the talocrural joint, the subtalar joint, and the mid-tarsal joint. Your talocrural joint is formed by the two bumps on the inside and outside of the ankle, as well as a dome-shaped bone in between them called the talus. It's what most people think of as their ankle. And that joint is pretty much a straightforward and backward joint, doing the motions known as plantar flexion and dorsiflexion. Now, when you're going upstairs or squatting, you need that motion of dorsiflexion to get your knee out in front of your toe. Additionally, when you're walking, you need that motion to get your body weight out in front of your foot. Now, if you don't have enough dorsiflexion at your talocrural joint, your body can find ways around it by pronating your foot or doing this, kind of flattening the foot or turning the toes out at the other two joints that I mentioned earlier, the subtalar and mid-tarsal joint. And we'll get to those in a little bit. But first, I want to show you how to improve the dorsiflexion at your talocrural joint. Now, before we get into the exercises for that, I want to have you do just a little bit of a pre-test. First, just try walking a little bit, see how your knees feel as far as pain, stability, if they feel uncomfortable anywhere, and just take note of what you feel. Then try to do a squat as deep as you feel comfortable going and see how you feel doing that. Now, for the first exercise, we're going to work on the mobility at the ankle joint as well. To do this, you can use either a stretching strap like this or something long and thin. A dog leash works pretty well, or a small towel. If you would like one of these, I'll put a link to this in the description below. Or you can use a stretching band, which I'll show you this in the second technique. But for the first one, you're going to put your foot up on a chair, or you can put it on the second or third stair of a staircase, and then take the stretching strap and put it right at the crease of the ankle there. Then you're going to pull backwards on the stretching strap. That pulls the talus backwards between those two bumps on the inside and the outside of the ankle. And then just go forwards like that, moving your knee forwards over your toe, and then come back. Try to keep your heel down flat on the chair as you're doing that. So just go as far as you can without your heel lifting up, and then come back, go forwards, back, forwards, and back. And repeat that for about a minute. Then after doing that, you'll move on to the second exercise. Before we go into that second exercise, I want to show you a different variation of this first one using a little loop band like this. If we're going to stretch this ankle, you put it around the ankle that you're stretching and then step on it with the other foot. Now you're going to stagger your feet out like this and then go into just a partial lunge. So now that loop band is doing the same thing that you were doing with the strap before. Either option works pretty well. It's just individual preference. I will note on this one, you do put a little bit more weight through your leg than you do with that one. So if you feel uncomfortable putting a little bit more weight through your front leg, then you might want to do the one with your foot on the chair or on the stair. So that's the first exercise. And again, that improves the mobility at the ankle joint. It also helps stretch one of your calf muscles, the deeper one called the soleus, which does not cross the knee. And those are very good for helping with things like squatting, because when you're squatting, if you don't have enough of that mobility at the talar crural joint or flexibility in the soleus and you can't keep your heels on the floor, that uses your quads more because you get your hips to come into it or your glutes to come into it by driving your heels down into the floor. And if you can't keep your heels on the floor when squatting, and you have to come up on the toes, that uses more quadriceps force, which creates more compression behind your kneecaps. However, when you're walking and you're pushing off, you don't go into quite that much dorsiflexion at the ankle, but you also have your knee straight. And so the primary limitation when walking is the calf muscle that does cross your knee, the more superficial one called the gastrocnemius. And to stretch your gastrocnemius, you'll keep your heel on the floor, toes pointed straight ahead, and then just lean in until you feel a stretch in the back of your calf. For some people, you may not have to lean very far. Even just standing upright like that may feel like a little bit of a stretch. Now, to see that from the other side, you also want to make sure you're not allowing your arch to flatten down when you're stretching. So make sure you maintain the arch of your foot like that. If you turn the toes out and allow your foot to flatten, note you can get a lot more stretch there, but you're not really stretching your calf any farther. You're just compensating by moving at the subtalar and mid-tarsal joints. So make sure you maintain the arch of your foot, keep the heel on the ground, and then just move your body forwards until you feel a stretch in the back of your calf. And then hold this for 1 to 2 minutes. So that was the talar crural joint. Now we're going to move on to the joints below it, the subtalar joint and the mid-tarsal joint. The subtalar joint is the joint between your calcaneus, your heel bone, and the talus. Subtalar meaning it's the joint below the talus. That joint has sort of a 45-degree diagonal axis, and so the movement is a triplanar movement. It moves through all 3 planes of motion, and it's kind of a diagonal axis like that. This motion going down and in, kind of scooping that way, is called supination. This motion going out and up is called pronation. Now, pronation, when you have your foot in the ground, looks something like this. Supination, when you have your foot on the ground, looks something like that. So you can think of it sort of as increasing the arch of the foot and decreasing the arch of the foot. Now, you also get pronation and supination at the mid-tarsal joint, which is the joint between your calcaneus, navicular, and cuboid. The subtalar and mid-tarsal joints work together. When the subtalar joint goes into pronation, that unlocks the mid-tarsal joint, making your foot a good adapter to absorb shock as you load weight onto it. Then as your subtalar joint goes back into supination, it locks up the mid-tarsal joint, making your foot a rigid lever to push off of it. Now, many people have heard of overpronation or flattening of the foot or collapse of the arch. And most of the time when people overpronate, people think of it as happening at the subtalar joint, but it's very rare to have your subtalar joint overpronate. And that's because the lateral malleolus, this bump on the outside of your ankle, goes farther down than the bump on the inside. That makes it really hard for your heel to go too far out that way. What happens as a compensation for that, if your subtalar joint can't pronate enough, 1 or 2 things can happen. Either your foot just doesn't pronate, making it a poor shock absorber, which can send more forces upward into your knee, your hip, or even into your back. Or you can overcompensate at the mid-tarsal joint, which makes your foot too floppy, and it's not a good rigid lever to push off of. That also causes collapse of the arch and causes the knee to go too far inwards when walking or when squatting. And so we're going to work first on subtalar eversion or subtalar supination. And to do this sitting down, you'll sit in a chair like this, cross one leg over the other. Now you're going to take the heel of your hand and put it just on the inside of your heel or of your calcaneus. Kind of grip around like this. This other hand is going to stabilize right above, kind of right around the two bumps or malleoli of your ankle. Now you're just gonna do a gentle push down towards the floor. In most cases, you won't feel very much happening. So don't expect your foot to move around like that. It should be a very tiny motion, just gentle little glides back and forth, and oscillate like that for about a minute. Now we want to work on stabilizing in the midfoot. And to do that, you're going to stand up, kind of dome your arch by gripping the ground like that, and trying to maintain the arch of your foot while standing on one leg. Now that becomes very functional because when you're going to walk, you don't want your arch to collapse excessively. Again, it should pronate a little bit as you're loading weight onto it and then go back into supination as you push off. But if you go too far into pronation and stay in pronation too long, then it can cause some stresses on the inner part of your knee. So again, practice doming the arch, standing, and balancing. Now, to take all of this into functional contexts, when you're walking, you want to try to slightly grip the ground with your toes so that your arch doesn't collapse excessively. It supports the arch, allows it to collapse a little bit like it should, but it doesn't allow it to flatten out completely. So keep the arch of your foot domed, slightly grip the ground with your toes when you're walking. Now, when you're squatting, you want to start out by finding a stance width that's comfortable for you, doming the arches slightly, gripping the ground like that. Now, when you go into a squat, your talocrural joint dorsiflexes, which means your knees go out forwards over your toes. Now, you don't want to allow your knees to knock in like this. Your tibia will internally rotate a little bit, meaning it spins in that way, but you're driving your knees out from the hips, utilizing your glutes. And so the net effect is that you keep your knees wide as you're coming down into a squat, then drive through your heels to stand back up. Lower down like that, keep the knees wide, drive through the heels, and come back up. Now try walking like that with your arch domed, and try squatting the way that we just described, keeping the arch domed, knees turned out, and then driving through the heels when you stand back up, and compare it to the pre-test that you did earlier, and leave a comment below letting me know how some of these exercises worked out for you. Now, if you'd like more tips to relieve knee pain, check out this playlist over here. But before you go, if you found this video helpful, make sure to give it a like, and if you haven't already, subscribe to the channel so you get notified of my future tips. Thanks for watching, and I'll see you in the next one.